While institutions may use different data systems, certain things are common to patient records the world over. The first page or first entry is usually the patient's personal demographic data, their name, address, date of birth, maybe their next of kin. Then comes their general medical history with past illnesses, treatments, surgeries, and their outcomes. And finally comes the section with their medical care, their clinical visits or treatments, usually recorded by date as they unfold. Now, even these daily visit notes or daily clinical assessment notes, they too follow a certain pattern. For example, it could be subjective, where it mentions how the patient feels, objective, what the clinician finds, assessment, the new list of problems, and plan, how you're going to manage this patient in the next 24 hours or whatever. Or it could be situation, background, assessment, and recommendation. A referral letter, however, is a different kind of document. It serves a different purpose and so should not be laid out exactly as clinical or hospital notes are laid out. Such a comprehensive and detailed layout doesn't focus a specific reader, your specific reader, on what they need to know to carry out their specific job. So a letter shouldn't be laid out in the same way, using the same language as in a case notes. And if you do this, follow exactly the case note layout, using exactly the case note language, if you do this in the OET, it gives the examiners the impression that you do not understand the information in the case notes, you do not understand the purpose of the letter, and you cannot distinguish between what information you've been given is important to your task and what isn't. So let's return you to being the reader. So this time you are a head nurse at a nursing home receiving a new patient who can no longer independently manage their activities of daily living after suffering a stroke. You're confident all the accompanying information is in order. So which of this information would you like to know immediately upon reading? Logically, after finding out who the patient is, you want to know how much care does this patient actually need? Now, it may sound a little harsh, I know, but naturally you want to know how much of your institution's resources will be needed, when, and how often. So ideally, after getting the patient's identity, you get the relevant diagnosis and also the level of assistance you'll need to give. Note, however, that these three pieces of information are not set out side by side in the detailed case notes. In the case notes, the patient ID comes first, but might be immediately followed by the family information. Medical diagnosis might come after examination findings and investigations, and management recommendations might also come after lab results and medications. So information in your letter would have been pulled from different parts of very detailed case notes and rearranged to highlight the most important aspects for you. Then you naturally wonder, how did this patient get to this point? Are there any other issues that are going to impact the care and care planning that we have to carry out? Because you want this patient's care to continue uninterrupted and as smoothly as possible. And another thing you might want to note is, who's the next of kin? So you look now for these specifics: medical illnesses, surgeries, allergies, examination or lab findings that fill out the picture of who this patient is. Additionally, family and social history, and who to contact in case of, for example, another stroke. Because all these points relate to your future management of the patient, and again, they come from different aspects of the detailed notes and are linked together in a logical manner, so that from one section to the next, you get concise information which is strictly relevant to your role. So yes, for example, this patient had an appendectomy when she was 20 years old. But is it relevant to you, the charge nurse at a nursing home now? No, it's not. So you don't want that information in a summary letter that you get. So switching you back now to being the reader for a minute, note that the points I mentioned so far highlight the dangers of using highly formulaic phrases or highly formulaic layout for your letter. You either give too much or too little info because the purpose and recipient needs are not really thought out. You include irrelevant details and or your arrangement of the information that's necessary is not the most efficient to convey the needed information. And efficiency is important. You get an approximate word count for your task. And yes, OET does not count and will not automatically deduct points if you go over or under the recommended word count. However, if you write double the word count, it suggests to OET that you've put in too much information, which in turn suggests that you didn't quite understand what was important and what wasn't. Conversely, if you write half the amount of words, it might suggest a complete lack of understanding of the language of the case notes or just poor time management. Now, in this last bit of this tutorial, I'll touch a bit on paragraphing and cohesion. Switching you back to being the reader again, paragraphs help English speakers and readers make sense of the information they're given. For English speakers, a new paragraph says, take a breath, we're moving on to the next topic here. So this letter that you've received has all the information you need, all the ideas are linked together, flowing logically, one after the other, what we like to call being cohesive. But then you look, horror! Everything is written in one solid paragraph. English speakers often use the first line of a paragraph to get an idea of the gist and detail that is in it. We have to work so much harder to pick out information if we have to wade through one long, solid paragraph. We don't like it. So a nice rule of thumb is linked ideas in one paragraph then flow smoothly to the next paragraph with the next set of linked ideas. So going back to the unrelated example of paragraphing that we met way back in Module 1, Paragraph 1. Mr. Jones, 80 years old, was admitted 4 days ago after falling and obtaining soft tissue injuries to his face, arms, and hips. He was mildly dehydrated and confused and showed signs of poor nutrition. He recovered well, but does not accept that he needs to continue taking his blood pressure medication. Mr. Jones' neighbors has reported, in fact, that Mr. Jones does not take his medication regularly and often drinks too much alcohol.